Diggy diggity bum bum bam, diggy diggity bum bum bam, diggy diggity bum bum bam. We vote in BNB. Hey, hey, hey. Everybody voting, they voting in time. Shelling, yes we shelling. They voting BNB, BNB down the line, BNB down the line. We voting BNB down the line. We voting. There was this. Diggy diggity bum bum bam, diggy diggity bum bum bam, diggy diggity bum bum bam. We voting BNB. Hey, hey, hey. Everybody voting, they voting in time. Shelling, yes we shelling. They voting BNB, BNB down the line, BNB down the line. We voting BNB down the line. We voting. There was this lady, she don't know what to do. Come and let me show you what to do. I said, come on, baby, vote BNB down the line. Vote BNB down the line. Vote BNB down the line. There was this lady, she don't know what to do. Come on, let me show you. I said, come on, baby, vote BNB down the line. Vote BNB down the line. Vote BNB down the line. 1, 2, 3, hey. Vote, 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 vote. BNB down the line. 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 We voting, we voting, we voting, BNB. We voting, we voting, we vote, we voting, BNB. We voting, we vote. When we go to the polls, we go in BNB. We voting, we voting, we vote, we voting, BNB. Everybody voting, they voting in time. Shelling, yes we shelling. They voting BNB, BNB down the line. We voting, BNB down the line. BNB down the line. Let me go, let me go, let me go, let me go. Vote, 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 vote. BNB down the line. Vote, 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 vote. BNB down the line. Vote, 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 vote. BNB down the line. You voted for BNB this election. Help me sing this part. Down the line. Down the line. Let's go. Down the line, 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 line. I can't hear y'all. Down the line. Come down the line. Down the line, 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 line. We going, yes we going. Down, vote, vote, vote. BNB down the line. Vote, 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 vote, diggy diggity bum bum bam, diggy diggity bum bum bam, diggy diggity bum bum bam. We voting BNB. Hey, hey, hey. Everybody voting, they voting in time. Shelling, yes we shelling. They voting BNB, BNB down the line. BNB down the line. We voting BNB down the line. We voting. There was this lady,
Good evening, Turks and Caicos, and welcome to another episode of This Is What's Up. I have a very, very special guest. We're in a new location just to get a good feel of things and just to have this guest speak to some of the issues that are going on specifically in the health department in the Ministry of Health. I have the Honorable Minister here, Honorable Shaun. Malcolm, how are you this evening?
Well, good evening, Ralph. How are you doing? It's a pleasure to be back on the show to talk all things health in these Turks and Caicos Islands. I want to say good evening to all our people across the length and breadth of this country. And I pray that all is well. I want to pass on condolences to all of those who are mourning tonight in this country, especially those who have lost their loved ones to crime.
Definitely. And Honorable, this is a special month for the Ministry of Health, for the world in general, celebrating breast cancer awareness. We did have the cancer walk in Provo. I believe that would have been 2 weeks ago, or last week Saturday, right?
Yes.
Yeah, so I just want you to speak a little bit to that, because we know cancer is impacting so many people in this country, around the world, and just some of the things that the ministry is looking at when it comes to cancer specifically.
Well, Ralph, you're right. Not only this month is breast cancer awareness month, it's also mental health.
Okay, great.
Month as well, and then there's violence and abuse month as well. So there's many areas that is being celebrated, or not celebrated, but
recognized.
Highlighted.
Highlighted, definitely.
In this month. But what I would like to do for the first few minutes is actually share give you a brief overview and share some statistics of what is going on as it relates to breast cancer in these Turks and Caicos Islands. I mean, breast cancer is certainly the leading health concern in the Turks and Caicos Islands, affecting a significant portion of our population and placing actually a big strain on the healthcare system in these islands. And, some of the key points regarding this disease and our ongoing efforts to address breast cancer in these islands. I'll share some cancer statistics with you. Breast cancer actually is the leading cause of death from 2010 to 2019 in these Turks and Caicos Islands.
Wow.
It ranks amongst actually the top 10 leading causes of death in the Turks and Caicos Islands. We have the number one, it's also the number one cancer-related deaths in the Turks and Caicos Islands. It is the primary cancer-causing death amongst both male and female.
Very interesting that you would say that. A lot of times, men you wouldn't think of that for men, right? But it does affect a small percentage of men as well, too, right?
Oh yes, breast and it's becoming more prevalent in these islands. You're finding that men are being diagnosed with breast cancer. So don't think while it's primarily a female cancer, I think male is right there. So male has to also, when they're doing their health checks, especially if you buff up top too, because you got some male out there very buff up top.
Yep.
And so it's very important for them to get their checks, make it a part of their yearly checks. We have the youngest diagnosis we have currently here in the Turks and Caicos Islands as low as 27 years old.
Okay.
And so what that means is very important that our young ladies begin to start their checks very early. We're seeing more young people being diagnosed with cancer in their 20s and their 30s, especially in their 30s and early 40s. And we are doing research to figure out why is this happening. Our oldest person we have in the islands is age 92 who has been diagnosed with breast cancer. You know, so in the Turks and Caicos Islands, the average age is about 53 years old. And you know, and the statistics show between 1988 and 2023.
Yep.
Between the ages of 21.5% of the diagnosis with breast cancer was between the ages of 25 and 44. And between ages 45 and 64, which is the critical age, 62.7%
Yep.
of our diagnosis here in the Turks and Caicos Islands it was between the age of 45 and 64. And then another 14.6% between the ages of 65 and older.
So overall, looking at that, you're seeing that median age is where the bulk of it is, right? And so
Yes.
the most
Yes.
important thing is to remind women, especially, but everybody, to get screened a lot earlier than you might think, right?
Yes, and the statistics will show between the ages in the 27, 25 to 44, that percentage is also growing, which is troubling to the health sector.
Yep.
And then it has breast cancer has a major impact on our mortality here in the Turks and Caicos Islands between 2015 to 2019. Breast cancer accounted for over 24% of all the cancer-related death in these Turks and Caicos Islands.
Wow.
So as we focus, and there were actually 2 cases of male breast cancer, have been diagnosed between that time here in the Turks and Caicos Islands. And on overall, not just through cancer, but the overall figures show that breast cancer made up 30% of all the diagnoses in the Turks and Caicos Islands. It's actually the leading.
Yep.
Yes, and because it makes up the highest percent, it's also one of the greatest costs to delivering health care.
Yep.
Here, between 2021 to 2023, breast cancer alone has cost us like $1.2 million was spent on treatment in the treatment abroad program as it relates to breast cancer, and that is not including the costs for providing chemotherapy.
Yep.
I think what we do here in the local hospital. And if you add what we are paying for the local treatment to the treatment abroad in this area, we are talking some good numbers.
Yep.
And that's just breast cancer. And so because, if those figures are in those areas, that give rise to having a social impact overall in the country. There's there's many social impacts that breast cancer can have that is outside, not just in the healthcare sector, but into the job market. When one is diagnosed and dealing with cancer, you have the loss of productivity. Many of the breast cancer patients experience a decrease in their work capacity. It impacts and if you have a decrease in your work capacity, then it affects your family income and overall your family, the economy.
Yep.
And then you have the emotional toll that dealing with this this disease. The emotional burden on the patients, the families. it's just profound.
Yep.
It affects their mental health. So it affects their, all their relationships. So you have that social impact that we experiencing in the country due to breast cancer, and then it will lead also to a financial strain.
Yep.
On the cost of cancer care leads to a significant financial hardship, especially for families with limited resources.
Yep.
Breast cancer and the ministry focusing on this area is very critical, and also the Ministry of Health, we have many initiatives that we are seeking out to help in this area. We are looking now at a population-based cancer register. We need to know who has it, where in the country we're seeing the high rates, and why.
Yep.
So
And that's something that's currently being undertaken by the ministry now.
it's currently
Yep.
being, we are aiming to collect, comprehensive data
Yep.
on cancer across the entire population.
Yep.
So that can further enhance, the trend.
Yep.
The trends of cancer, so that our healthcare providers could be more informed, and they can plan.
Yep.
And how do we pin down this disease that is wreaking havoc in our country. So and there's a lot of benefits to doing in the register.
Of course, and I'm glad that you started with that, Honorable Minister. Of course, it was important for us to just start there. To everybody has somebody, I'm sure, whether it's a family, a friend, or just even a colleague or somebody you've seen from a distance that has been affected by breast cancer or just cancer in general. So it was important for us to recognize that, especially in this month where we're celebrating that and we're recognizing folks on that. And so I want to take some of what you said in there and pivot into this conversations that we're hearing in the mainstream, the questions that people want to hear answered from the Minister of Health. Let's go into that area of treatment abroad, treatment abroad policy, NHIP. How does that all work? What things have the ministry been working on to make sure that anybody that needs the right care or needs care is getting the care that they need fast enough, that they're getting into the right facilities? Give people a little bit more confidence to what your ministry is doing and why they should be confident in the facilities that we do send people for treatment abroad.
Well, Ralph, treatment abroad is certainly a big issue here in these Turks and Caicos Islands. It is one. It's not new.
Yep.
It is not a new issue, but let's go to NHIB.
Yep.
Let's take a look at the institution. The institution has been going through many phases since its inception. It's relatively 14 years old, and it's governed by policies.
Yep.
And ordinance. And we have gone through a number of issues in terms as it relates internally, staffing, but also the policies that governs the institution merits a number of it has a number of different factors.
Yep.
And it works hand in hand with other institutions in terms of let's say for treatment abroad. One has to go to the hospital in Health Canada, which is an entity on its own. You attend the doctor. the doctor makes a diagnosis, makes a referral. NHIP is not activated until there's a referral,
Yep.
an independent referral coming from the hospital.
Yep.
Now, some patients may go to the doctor today and be told that we're going to refer you for further treatment. It doesn't mean that that referral reach NHIP that day.
Yep.
That referral could reach to NHIP 6 weeks from now.
Yep.
In some cases, 6 months. Because you get a lot of, you have a number of issues where people say, well, I've been to my doctor, minister, I've been to my doctor told me that he was writing a referral for me, and I hear nothing from NHIB.
Yep.
You pick up the phone, you call the NHIB,
Yep.
you haven't seen no referral for John Doe.
So where's the ministry? I got to keep you on it, Minister, because the people, this is the question I think people want to know, and I know you're going back, but where's the ministry? And I know there's probably work being done to close that gap.
Oh yes, not well. Again, the institution lacked leadership for
Yep.
quite some time.
And there's a new appointed CEO, right?
So we have recruited a CEO. What we have been doing, well, since I became minister,
Yep.
we've recruited a CEO. The institution didn't have a financial controller for quite some time. We have now successfully recruited a financial controller. So things are beginning to trend in the right direction now.
Yep.
With NHIB. The issue of stipends has been a long-standing issue where the amount, whether it's sufficient.
Yep.
The new the direction that the ministry is taking NHIB. We are working on getting to that point where you as a patient or the person that is traveling with you
Yep.
won't have to worry about those issues. We're looking for a total package fix, where if you're going to Miami or DR or wherever in the system, all of those details will be taken by like a one-stop shop.
Yep.
So eventually you won't have to worry about where I'm going to stay,
Yep.
who's going to pick me up, will I get a bill, and I think people sometimes forget that Rome wasn't built in one night, and with everything, it is a process.
Yep.
And I understand very clearly, Ralph, that our people has been waiting so long for a fix till tomorrow it seems long.
Yep.
Seems long. But government on a whole runs by process.
Yep.
And so so there are processes that have to be followed.
Yep.
And everything goes with numbers. You have to do your analysis, and you have to show how you're going to pay for this, and that's what it requires.
Yep.
So it's going through those processes. Now, with the new CEO, has his mandate, the board has their mandate, and we have seen things ticking in the trending in the right direction, and I'm sure that in the not too distant future, a lot of these concerns that's been out there for years, will be. Now, if you go into the public, yes, there are a few loud mouths for some reason But there are way more
Yep.
people that are their needs are being met.
Yep.
I always say health is not, it's not sexy. It's not an area you can boast and talk about, because people health is very sacred.
Yep.
And also, it doesn't mean because you don't boast about it
Yep.
that people are not being served. I said it before. I mean, I just came from directing council in Washington, D.C. This is the time of the year when all the health ministers from the Western Hemisphere, from Canada to the tip of South America,
Yep.
we gather to discuss and deal with global policies and issues. And every time they talk about the delivery of health care to their people, they mention Turks and Caicos,
Yep.
and especially in the Caribbean.
Yep.
Our people has no idea. I'm not saying that it is perfect,
Yep.
because it's not. And we are doing everything to make it better.
Yep.
But I always liken it to the people of Israel. When God delivered them out of Egypt,
Yep.
and they were on their way to the promised land,
Yep.
and God was feeding them every day,
Yep.
and manna. And they didn't realize, that they was getting nutritious food. And they murmur and complain. And God said, because you murmur and complain, you will not see the promised land. You'll move in circles. And what I see, I see my counterparts in the region. Everybody wants the footprint on how are we doing it so well.
Yep.
And Turks and Caicos. In many other jurisdictions, you get diagnosed with breast cancer. For instance, in those jurisdictions, there is no NIB. Those families, some people got to sell their business.
Yep.
They have to raise money to see if they can get treatment. Some spend until they are broke. They go, we talk about the social impact
Yep.
that cancer has.
Yep.
But in the Turks and Caicos Islands, that is not our story.
Yep. So with that, and the reason why I wanna bring it back to the main three things that I think people want to have clarity on, and there's two things. There's the other side per se, or there's the counter argument, whoever it might be, who would say NHIB is a failed institution, or it's an institution that can't that will not be able to be maintained. But then the question then most people would then ask, then what is the other solution if it's not NHIB? To the point you're making, in the region, people are trying to get to that type of institution. So I want you to speak to that and why that institution that was established, why that there was so important. And then also, again, like I said, back to that treatment abroad question as well. And just the institution in and of itself, where's the confidence lacking in why the people, like you say again, may not see the manner and take it and say, well, hey, I'm getting top notch for my dollar. And how can we build, what is the ministry doing to build that confidence?
Well, again, NHIB as an institution had, and still just about coming out
Yep.
of it's went through so much changes
Yep.
internally.
Yes.
So and it ain't an internal issues that just started.
Yep.
It's internal issues for the last 10, 15 years. It has seen so much turnover in staff,
Yep.
right? And because of that,
Yep.
if you don't have enough accountants, to keep up with things. You don't have enough agents to deal with patient care.
Yep.
I mean, in some cases, it was down somewhere to, they had like 2 or 3 persons dealing with patient care.
Okay.
That's an area that requires 24 hours a day because you don't know when an emergency will happen.
Yep.
And you need to fly people out.
Yep.
But then you got to think about the staff. So if you're working, you're dealing with when an average agent should be dealing with perhaps 20 patients. That one person now dealing with 200 patients.
Yep.
And the patients are not in one location. You may have patients in Colombia, patients in Miami,
Yep.
patients in the DR, patients in Jamaica, patient in Cayman.
Yep.
And so you have complaints where we can't get our agent, they're not answering, I'm over here.
Yep.
And that's what gives rise to one of the fixes that we need to get, like medical concierge companies in these destinations
Okay.
that can deal with all our people concerns and issues when they are on the ground in these countries. And I do sympathize with our people because I can't imagine. Can you imagine you sending a patient to Jamaica, for instance, and their family member never been to Jamaica?
Yep.
They hear all of this, they reach, sometimes somebody's to meet them, sometimes somebody's not. Can you imagine?
Yep.
You're in a strange land.
Yep.
Right? So I do understand, and that's why I've done everything in my power to ensure that the fix,
Yep.
and we are fixing that. And so the institution has had a lot of internal issues that we've been working on over the last several months. There is a light to the end of the tunnel, and again, it had no leadership. For over 6 years, there was not a substantive CEO, nobody guiding the ship.
Yep.
And so that was one of my first thing as the minister.
Yep.
You know, is to first, if I am to fix it,
Yep.
I had to get to the root of it, and then I needed to find a competent person to bring it out of the rubble, because, to be honest, NHIP is an institution that just cannot, in the best interest of all the people of this country. Can you imagine
Yep.
this country without that vehicle?
Yep.
So in my view, it cannot fail.
Yep.
And I'm working every day as the minister to ensure
Yep.
that what needs to be fixed and turned around to make it, one, to remain viable,
Yep.
and two, to deliver the service that the people of this country deserve. I wouldn't say that the people has been getting the level of service that they should, and we are doing everything to eradicate that problem.
Yep.
But I can tell you that we are way on our way, and you know, you have, with health, you got to have a level of empathy.
Yep.
Because the kind of fight that you got to fight in this ministry,
Yep.
ministers that are hard fixed wouldn't do too well in this kind, because
We don't have any of those on this side, so.
no, not in our government.
So we don't have that problem over here.
But but it requires
Yep.
it requires a lot of empathy
Yes.
to deal with people's health needs. And
Yep.
and you know, I just thank God that He has blessed me with that kind
Yep.
of empathy, and I work every day to improve it.
Yep.
And it is improving now. But all the issues ain't just NHIB, because there are other
And we're going to get into some of those too.
areas
And I don't want
that
to,
feed into
of
that.
course. And I think the one thing that I want to stress is that while we're saying issues, I think we need to look for, or it's better to look at it as what things perhaps weren't operating the way they need to.
Yes.
Looking at what the ministry has done and what the ministry continues to do. Because another element to this would also be, what is the government in the relationship with the hospital, and making sure that we're getting, making sure that even primary care, for example, then filtering into your secondary care and all of that. What are the things that the ministry is doing in that level, and then what are the plans to expand healthcare here? Because another question from a lot of the mainstream in the streets and people that want to know is, when do we then expect to be at a point where we're not having to do as much treatment abroad, but where these problems could be handled on island?
Right. I'm glad you asked, because Ralph, there is a lot of work going on behind the scenes. The first step, I told you, I said earlier that no fix come overnight.
Yep.
But you have to find what is the root of the problem.
Yep.
So yes, working with my counterparts in the region. As you know, I serve on the board of CAFA and COSAR, which is CARICOM in the region. And that vehicle opened so many doors for me for the country, because you have access to a lot of resources and knowledgeable people in the sector. So we have primary care in this country over the last 14 years to 15 years has certainly went flat. And there's a reason, there's a direct correlation with the reduction of primary care and the onboarding of the hospital. There's a direct correlation to that. One of the things is in strengthening and rebuilding our healthcare sector is we have to focus on building our primary care, bringing it back up to par. So I have initiated through the ministry working or review, a health sector review, looking at the overall delivery of healthcare within these Turks and Caicos Islands. That review is certainly on its way. And that will tell us in the next few months exactly the direction we need to go in the healthcare sector. In May, I launched the Health Strategic Plan for the next 3 years to 2027. That is a short stop. That is a short-term fix to put a Band-Aid on the current bleeding in the system, while we get an in-depth review of the total sector. I mean, for instance, based on our population that we know, there's a greater need. We need hospital beds.
More beds, definitely.
In this country, we are far below, based based on the population size. There's need, so the government can't do it all.
Yep.
So there will be need, I can see coming out of this review for the health sector. There's need for private hospitals, more beds.
Yep.
This, based on our population, our bed count should be somewhere between 240 to 260 beds to service this country.
You think that many?
Oh yeah.
Okay.
Based on World Health Organization standards per whole
Okay.
and our population. That's based on the last pop statistics.
Yep.
We are almost 90% through a next census.
Yep.
And we expect that the numbers will be far different,
Yep.
more.
Then what we quote each day.
So this healthcare sector review is critical.
And you said that review will be taking place over the next few months. How long
Yes, it has-
a review like that is expected to take to finish, to complete? Like how long does that usually
That probably will take about 9 to 12 months.
take? Okay, so that's a detailed, intensive review.
Oh yes.
Yes.
Oh yes. And I'm looking for a 30 to 50 year plan
From that review.
to overhaul healthcare for the next half a century in these Turks and Caicos Islands. And
So let me ask you this question, not to cut you off. And this is something I always wonder about governments. You know, you switch governments, and let's just use this as an example. Going into another election, you would have a review done, right? Where do these reviews go? Because you would hear the oppositions, the other side who just were in, they would say that, oh, well, we've done reviews or whatever, right? Was there a plan in place when this administration took office? Was there something that was already in place, or was this the first time we're now saying, hey, we must solve this problem and let's get this detailed review?
well, if there was one in place, I certainly haven't seen it. That's number one, because there should be continuity
Continuity, yeah, exactly.
in government. I care about this country,
Yep,
and it doesn't matter who brings it forward.
yep,
If it's right for the people, if it's right for the country,
yep,
it doesn't matter which party
Yep.
brought forward the review. But there's currently none exists.
yep,
But there's one on the way.
Yep.
Because, you know, my government, we are not afraid to make big decisions.
yep,
And we are not afraid to take on big tasks.
Yep.
And sometimes taking it on when people don't understand where you're trying to go, you'll have to say, well, why are we doing this?
yep,
Today we need a review. When the review is up, well, why we do the review? And you know, so you have to be focused.
yep,
And so that is one thing. But we have a other part of our healthcare system that we needed to fix.
yep,
And that system is called in the Health Canada.
okay,
And why I can and will not go into much details about, but it is a huge part of our impediment in our healthcare system currently. And what I've been doing for the last couple of months is doing everything to get that issue on the table. And Ralph, there's a saying that we all know generally in this country how the people are people. Feel when it comes to people say the hospital.
Yep.
What I have done, my government, with the blessing and support of my premier, we have over the last couple of months did everything to get the key players in Interhealth Canada to the table. And I want to report, I want them to listen good. They better put this on Free to Speak tomorrow. If they want a headline, let me give them a headline. What I have accomplished in the last 11 months as the minister, for the first time since the inception of this hospital deal, I've gotten the key players to the table.
But this would be key players on both sides.
The key players, yes, government
Yep.
and Interhealth Canada and this contract. For the first time in 14 years to the table.
Yep.
Now that's already a victory for the people of the Turks and Caicos Islands. Because, Ralph, now let me put this in proper context. You could go out on that street all day and all night out there. That's Shaun Malcolm, blah, 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 blah. And I open their office, right?
Yep.
I can pay you any mind down there on that street? No, 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 no. But if you come to the table and you sit down and we talk and negotiate, maybe we can get something done. But the only thing rests on my mind every day, and when I say my prayers, Lord, please direct me to do the right thing for all the people of this country. Not some, not blue, not yellow, not green, not pink, all. And that's how I govern. And no matter, people don't say much, but I touch and deal with people all across this country every day. And I don't ask them who mask they power, what color they wear, or none of that. I deal with their issues. So that one time there was a saying, big things popping. Well, Ralph, big things popping in the Ministry of Health. Yeah. And I can tell you, and listen, and I will go on record and tell you this. Just getting it on the table is already a big victory.
Yep.
So you want to know what Shaun Malcolm been doing? I am a fundamental Baptist. You know what that means? One of the things in the Baptist we say, walk for the night is coming.
Yep.
When man can't walk no more. Well, Ralph, I've been Minister of Health for 17 plus months, and I've been walking while it's day. Because night is coming when man can't walk no more. And I walk for the people of this country, and they gonna see, because they've been begging for a fix in this healthcare system. I've been victim years ago to this system. So who feels it knows it. And so we are all walking in tandem, but I can assure the people of this country, whatever the final fix comes out at the end of this reset exercise, the people of this country, when it comes to this issue in this hospital, will be the winners with this great PNP.
So let's go on to, and thank you for addressing the health part. I want to go on to another part of your ministry, which is environmental health. Of course, there's I don't want to call it an issue, but there has been sentiment out there, especially I know on the island of Providenciales with garbage collection. And I would
yeah.
just like you to speak to that a little bit as to, what's changed in the ministry there, or what is causing some of the backlag that we have been experiencing as of late. And if you can just give an update on what the ministry is doing to address that currently.
Real Ralph. One thing, the Ministry of Health is the largest ministry in the Turks and Caicos government. We have some 17 departments that I manage. And environmental health is one of them.
Yep.
And when you think about all these departments, from health, NHIB, environmental health, health promotion, hospitals, you go down the line, senior care, mental health. I got
It's a lot. You said
yes, it's a lot.
Yeah, I don't want you to. When you start naming, you might leave somebody out. I don't want you to start getting too deep.
So, you as a minister, you have to keep your hands on the pulse. And one of the things I noticed also, not just NHIB need fixing, not just hospital issues need fixing, but also the environmental health, our next huge problem we inherit. The landfill, one area.
Yep.
Garbage collection.
Yep.
So the garbage collection I discovered was first being collected by some 5-6 companies.
Yep. And you're speaking to the island of Provo specifically.
In Providenciales.
Yep.
Because it is different in every other island.
Yep.
But that too
Yep.
is coming to full circle because the comprehensive review and consultancy by the Caribbean Development Bank
Yep.
that was entrusted to come up with a national fix for our refuge
Yep.
and solid waste in the Turks and Caicos Islands. I'm now in possession of that
Yep.
final report, and I've taken it to cabinet. I've
Yep.
gotten the blessings from cabinet, and we are actively beginning to go into the implementing phases of a new national fix for the way we manage our solid waste and
Yep.
our landfills.
Yep.
But Provo is broken down into 9 areas. And I can address this the best way I can.
Yep.
Because I know people has been talking out there. We see the talks every day. But I have to always remind them there's always 2 sides to a story.
Yep.
And for some reason, it was engineered for some reason that 5 other companies was pushed out a few years ago, less than maybe about 2 years ago, and one entity controlled the whole sector collection. Now, the question became, I began to get so much complaints and areas my garbage ain't being picked up. So you begin to zero in on, well, it's this company adequately servicing all these areas. Then why was 5 other pushed out and only one entity and sub to one more entity is now running the whole collection?
Yep. So it was one entity monopolizing the whole.
Monopolized the whole collection.
Yep.
And so the job was being poorly done, so it was reviewed.
Yep.
And the contract was terminated because of performing.
And when was that done?
The
termination or around
contract
that?
came to an end on September the 18th.
Okay, so
September the
we're
18th.
looking at less than a month ago then.
Less than a month
sort
ago.
of when we see the sort of
Right.
the garbage
But-
kind of stifling up.
No. if you go to the media, there was a release put out in magnetic media, where magnetic media was told by that entity that their contract came when they were approached about why the country was so dirty and back up with garbage. They told magnetic media, and if you can go to the article, and said that their contract came to an end on the 18th of August, and the ministry had no plan. I saw people read it, and the ministry had no plans.
Yep.
And so, but that was not so. So the garbage wasn't picked up. So so
rewinding that back just so everybody is clear on what was said. It was purported that the contract had ended a month earlier than when it actually ended.
And the ministry was not prepared.
Yep.
That was far from the truth. The contract ended September the 18th. So which means that contractor deliberately was not picking up people garbage for some 3 weeks.
Yes.
And deliberately allow the country to swell over with garbage. Now, this is a man who's offering himself to represent the country, by the way.
Yeah. I wasn't aware who had the contract. So.
Okay. Well, that's the man who couldn't say representation on the lounge. Yeah.
Okay.
But God, listen. It was backed up.
Yep.
Right?
Okay.
So there's an issue, there's a gray area there because and I got reports, this island is small. I got reports that his colleagues were being told to go to these garbage pile up places to take pictures. Current members who are running for his side.
Yep.
To take pictures to make the government look bad.
Yep.
But it was intentionally left.
Yep.
The new country, today there's a overall review being done on how we're going to collect the refuge in the future. So right now, so as of the 18th, those 5 the other 5 that was put out of business couldn't make a dollar by that maneuvering. Plus 2 more went to work in different areas. So you can imagine they had so much garbage backed up for the last three weeks. That's why people were saying, "Oh, they look like the garbage is being collected," but that is not the case today. We have very competent garbage collecting companies. They are now in different areas. Collecting, so the noise should be thing. Again, we have to review. Provo has grown so much that the time has definitely come for daily collections because right now they on different routine. But again, everything is a process. So to take it to daily collection, I can, as the minister, implement that till the next budget cycle. Right, because you're talking from going from 3 days collection to daily collection. So which has financial implications.
Yes, and in manpower and more contractors probably needed and all of that.
Yes,
right?
and but it's important for the country to understand, and especially the people in Providenciales to understand why the garbage was backed up. That was intentionally done because the day after the contract, instead of having 1 contractor, you would have 7 contractors now permeated through the island. So there shouldn't have been no need. So when they said in the media that his contract was terminated, and and the ministry was not prepared.
Yep.
I mean, that was not only false, that was a lie. So you'll see certainly things are better.
Yep.
The backup, it's pretty much.
And I wouldn't be remiss on that same topic to speak, have you speak before we get to the end about the dump situation, especially some of the work that's been being done there, and the movement that's been made on that, and where we expect that to head as we go into a new administration, the groundwork that has already been laid down.
Oh yes,
there.
yes. One of the things, because my government came to on a mandate of taking care of the social needs of our people, and when you look at everything that we have been doing, it caters to dealing with the social needs of our people, and certainly the landfill situation. Where we met it.
Yep.
The people of Wheeling, while the election was close, in the election of our representative down there, I could say it. Honorable Kyle Knowles is one of the best representatives I've seen, and I've been in politics 29 years.
Yep.
So I know Johnny come lately to the front line of politics in this country.
Yep.
The only one being longer than me is the premier, and everybody just reach. You hear what soon reach? Everybody just reach, and I talk about on both sides, and he has done a marvelous job in representing and working for the people of Wheeling.
Yep.
I counted a privilege before he became a minister.
Yep.
Working with him.
Yep.
And the boy, he had me up late in the night. You should see me on the dump and all. I had to do it.
Yep.
And so the landfill had a lot of issues. It was unprotected. You have some people who have been scavengers, who've been walking the landfill for a business. Some of them are highly upset now because they can't get into the landfill.
Yep.
We have on board, just like the NHIB, the landfill in Provo had no contractor, no one responsible for its management for over 6 years. I fixed that too.
Yep. So there was no contract manager there, period.
No. For over 6 years. I fixed that too.
Yep.
That is fixed. And so we went through the fire extinguishing exercise. So it was critical to make sure secure. And I thank my cabinet colleagues for working in tandem with me.
Yep.
And to solve this problem for the people of Wheeling and Blue Hills.
Yep.
The reality is we've already on our re-election because we have delivered.
Yep.
And I keep telling them, I heard the Honorable Holness from Jamaica was speaking a few days ago, and he said, he said, the only thing you can go to the people on is your record.
Yep.
And I say it, and I've always said that in our parliament. In politics, you're judged by your record.
Yep.
This is what we have promised. This is what we have delivered. And so the landfill is certainly, by far, it's perfect, not yet. But we're getting there. I just told you we got the comprehensive fix.
Yep.
And we will fix it in our next term.
And tell the people, speak to that comprehensive fix, exactly what that finish line would look like.
Let me finish with Wheeling, because in fixing that, we had to deal with the air quality for the people of Wheeling and Blue Hills and Provo on the whole. Those systems are implemented. You could breathe much better down on that side of the island.
Yep.
And so with the comprehensive fix, I said that we have the report. As you know, we're not bound by the
Yep.
report. I have to look at it and see what fits these islands.
Yep.
Right? So, because most of these consultancy and report is just a guideline. You as politicians, we as politicians, have to have the vision. We have to have the vision to determine what is right for our environment.
Yep.
And so, with the long-term fix, you will see our garbage being disposed in modern ways. Right now, everything is mixed up into one conch salad. The culture of separating our waste
Yep.
is much needed, especially in Providence Islands. We are starting the pilot program in Grand Turk.
Yep.
Grand Turk, oh my goodness, I wish I had more time. I had to come back to talk about environment because we have fixed so much things and we are doing so much things.
Yep.
And environmental health, I mean, we're doing so much things. I told you just now, we're taking care of our people's social needs. And I got to tell you about this, Ralph, because one of the things we have also fixed, our people from North and Middle Caicos, our
Yep.
dialysis patients from North and Middle Caicos, flapping on the boat
Yep.
to get to Provo. Man, that's the thing, the past. I fixed that too. Thanks to this good government and Honorable Chuck Musgrove and our premier, North Caicos, Middle Caicos, so the dialysis patient, they will have flight services.
Yep.
3 days a week, the plane pick them up, bring them Provo, they do their dialysis, and go back. We fix that.
Yep.
That's taking care of their social needs. We have the center
Yep.
for the senior citizens. A team went down a few days ago from planning, from my ministry, getting the final scoping.
Yep.
I mean, you know, we purchased the property, and I told you the last time I was here, some people was making noise, but talking about we putting our people on prime land. I mean, after when seniors already served this country with all how they deserve to live out their sunset years in the best we can give them, and by golly, this good government, oh my God, we can give them the best.
Yep.
We will do that, and I don't want Provo think we forget them. I gotta come back so I can just talk about what we're gonna do
you
for
got the floor,
what I
Chief.
can do for
It's
the
all you.
seniors of this country
Yep.
in the next 5 years. But also taking care of their social needs. The other big issue we have is delivering our people to in the treatment abroad. I told you the last time about the ambulances. Some people say, what do we need 10 ambulances for? And I told you that if you can't get to the hospital, you just go to dead. So it is critical to have ambulances in strategic spots in the country. So that when you get an issue, they can get to you in a timely manner to get you to the specialist. No specialist go to nobody's house. You walk in the hospital system. You ever see any specialist go to anybody's house?
No, you got to come.
You got to come to the hospital.
Definitely.
So you can have 1 million specialists. If you can't get to that hospital in a timely manner to the specialist, and you go to stand.
Yep.
But also another issue, big issue that me and my government is well in advance in fixing, is the issue of air ambulances. The time we have to wait for an air ambulance to come to take our patient, critical time. No longer in our healthcare system we can afford to be waiting sometimes 2-3 days. The public don't know. They say, Lord, my mom been waiting. No, they say she was supposed to go tomorrow. The thing ain't coming till tonight, and that's how it works globally. The only fix is to get an ambulance station here. It's another social issue, taking care of people's social needs. Ralph, we as a government.
And this is all in the strategic plan, right?
All in the strategic plan.
And so this is all the next 3 years out, and how we
No.
happening now, right?
Yeah, ambulance is a critical fix. There ain't no down the line.
So speak to that. Speak to that directly, Minister.
That ain't down the line. That is way advanced.
That's way in advance.
Oh yeah, saving our people's life is paramount.
Yes.
To me, the premier, and our government. And people don't understand. Whether you are a tourist, whether you're me or the premier or anybody, if you can't get that service in a timely manner, you have a stroke patient window to get to a high dependency institution is 6 to 8 hours. You can't be waiting 24 hours for a plane. I'm fixing that because it needs to be fixed for our people, and it's a big fix. Again, man, every time we turn around, I smile sometimes when I see some of the detractors on Facebook, and they, what's Shaun Malcolm doing? Hey, I'm a good Baptist, fundamental. I walk while it's day, because when night comes, see, and night is coming, because the polls will open. And when the polls open, Ralph, I can tell you, all across this country, the people will return Shaun Malcolm. They will return our leader. They will return. They're going to return all. We can have Lord have mercy. Because because we are at a critical point. We are not a perfect government.
No.
But this ain't no time to turn around now. This country needs political stability. We need to finish the work. This country, as I say, we ain't perfect, but they know they can trust us. How they know? Because we told them. We told them 3.5 years ago. If you trust us, we will take care of your social and economic needs. And they trusted us 14 to 1, and by golly, in less than 14 days, they had their first stimulus. That's trust. That's reality. And not only that, it wasn't enough, so we give them a next one. And when they turn around, by golly, we give them a next one. And if when necessary, we will continue to do. And I can tell you, when it comes to those folks over there, and this good government, and the people of this country say to themselves, when we go to the polls in a few months, if we are in crisis in this country, who can we trust? And I can tell you, it is going to be resounding. The P&P all the way.
Oh man,
Thank you, Ralph.
I got to end the show right there. I don't even have to ask you to say the final words.
I finished.
Honorable Minister, I appreciate you coming out, and I appreciate everything that you laid out from the healthcare perspective. And I hope that gives people more clarity as to what the ministry is doing, where the ministry has taken things since you've been in as a minister.
Oh, the cries haven't gone on deaf ear.
No, and definitely you've explained very well all the things that we should expect even coming into a possible new term. So I just want to thank the people of the Turks and Caicos again for tuning in to another episode of This Is What's Up. And we will see you same place, same time next week, Tuesday.